Imagine walking into a hospital for something as simple as a minor infection and never walking out again. What if I told you there's a silent killer lurking in hospitals, one that claims more lives than heart attacks, strokes, or even cancer? This is the terrifying reality of sepsis. And today, we're diving into the shocking story of how a simple mistake in medical AI nearly cost lives. Understanding sepsis. Sepsis. It sounds like something straight out of a sci-fi horror movie. But guess what? It's real. And it's deadly. Sepsis is no joke. It's a full-blown medical emergency that can take a small infection and turn it into a life-or-death crisis, fast. Here's how it works. Your body detects an infection, and instead of calmly dealing with it, your immune system goes into panic mode. It starts attacking everything, including your own organs. And when that happens, you're looking at serious tissue damage, potential organ failure, and, in the worst-case scenario, death. Yeah, the stakes are that high. The scariest part? Time is everything. The longer it goes undetected, the worse it gets. Every second could mean the difference between life and death. But here's the problem. Sepsis is like a master of disguise. Its symptoms? Super vague. Fever, confusion, a fast heart rate. It looks like a bunch of other illnesses, making it incredibly tricky to diagnose. And that's where AI was supposed to change the game. Artificial intelligence, big brain technology, was designed to scan mountains of medical data, find hidden patterns, and predict sepsis before it got dangerous. One company, Epic, decided to take this challenge head-on. They created a tool meant to do the impossible: detect sepsis early and save lives. And if it worked, it would be a total game changer. Epic's ambitious goal. All right, let's talk about Epic. If hospitals had a big boss of medical software, Epic would be it. Their electronic health record system is used in hospitals all across the US. So when they dropped their sepsis prediction model, it was a big deal. The idea? Simple. Use AI to predict sepsis before it got out of control. If the system spotted warning signs, doctors and nurses would get an alert. Sounds amazing, right? The algorithm analyzed patient records, crunched the numbers, and looked for high-risk patterns. If sepsis was on the horizon, bam, instant warning. If it worked, thousands of lives could be saved. But it didn't go as planned. Turns out, the system had a huge problem. It was missing way too many cases. When algorithms fail, imagine if fire alarms only worked half the time your house caught on fire. Not exactly reassuring, right? That's basically what happened with Epic's AI model. Studies found that the system missed 2/3 of actual sepsis cases. 2/3. And these weren't just numbers on a screen. These were real patients in real hospitals whose lives were on the line. When sepsis isn't caught early, every second wasted makes survival harder. The delay can literally mean life or death. So what went wrong? The AI. It was easily fooled. The system got tripped up by other common medical conditions that looked like sepsis but weren't. It was like mistaking a tiny campfire for a full-blown wildfire. And that wasn't even the worst part. The human factor, alarm fatigue and distrust. The AI didn't just miss sepsis cases. It also went into full boy-who-cried-wolf mode. It started throwing out too many false alarms. Picture this. You're a doctor or nurse, and every few minutes, your system is screaming sepsis. Sepsis. But most of the time, it's wrong. It's like a car alarm that goes off every time the wind blows. Annoying, right? Now, imagine that happening 100 times a day in a high-stress hospital setting. Doctors and nurses started tuning out the alarms. They were mentally exhausted, overwhelmed, and worst of all, they started ignoring even the real alerts. This is called alarm fatigue, and it's a huge problem in medicine. Then came the knockout punch. A study from Michigan Medicine exposed just how inaccurate the AI was. Turns out, Epic's model was nowhere near as reliable as they claimed. This raised serious concerns. Can we really trust AI to make life-or-death decisions in healthcare? Striking a balance. The future of AI in healthcare. The story of Epic's sepsis prediction model is a massive wake-up call. Yes, AI is insanely powerful. Yes, it can analyze data faster than any human ever could. But here's the reality. It's not perfect. And in healthcare, not perfect can be dangerous. AI in medicine has so much potential. Imagine robots performing surgeries with pinpoint precision. AI-powered systems creating ultra-personalized treatment plans. The possibilities are huge. But here's the truth. AI isn't some magical, all-knowing genius. It has limits. It makes mistakes. And when lives are at stake, those mistakes matter. That's why human doctors and nurses are still the MVPs of medicine. Their experience, intuition, and judgment can't be replaced by an algorithm. AI should be a tool, not a replacement. So what's the solution? We need AI that works with healthcare professionals, not against them. We need rigorous testing, smarter models, and systems that actually help, not overwhelm medical staff. At the end of the day, technology should make healthcare better, not riskier. If we get it right, AI could help save millions of lives. But if we get it wrong, the consequences could be catastrophic. So, what do you think? Should hospitals keep using AI for critical diagnoses? Or is the risk just too high? Let me know in the comments below. And that's a wrap on today's exploration into the fascinating realm of AI anomalies. If you enjoyed unraveling the mysteries with us, don't forget to show some love. Hit that like button, subscribe to our channel, and make sure to click the notification bell so you never miss a moment of our captivating insights. Until then, stay curious, stay connected, and keep exploring the wonders of AI with us.